Good morning everybody. Shall start with MCQs on special senses. So I hope by now you all are studying well and prepare well for the internals. I know it is tough sitting at home and studying, but then online classes, I suppose it has helped you, and hard work pays. At the end of the day, it is only hard work. Okay, so please study very well and score good marks. So, first question on special senses. Okay, what is this? Hypermetropia is corrected by. So now you should know, I'll tell you short notes here. Hypermetropia is a definite short note. So what do you mean by hypermetropia? It is hypermetropia means long-sightedness. He can see distant objects but he cannot see nearby objects. Hypermetropia. And here it is corrected by which lens? It is corrected by, what's the answer? The answer is, it is corrected by convex lens. So hypermetropia is also called as long-sightedness. That means far-sightedness. He can see distant objects and images, but he can't see nearby objects, and it is corrected by convex lens. Hypermetropia is a short note. Next, presbyopia. Now you should know what is presbyopia. Presbyopia is old age. So after 40 years, when the lens starts becoming old, and you see the elasticity is lost. So slowly it's lost over a period of time. So how do you correct it? It is corrected by bifocal lens. It's corrected by bifocal lens. Astigmatism, again hypermetropia, presbyopia, myopia, astigmatism, everything is a short note, and astigmatism is a fine marker. So you should write regular astigmatism, irregular astigmatism. So by now you should be knowing what astigmatism is, irregular surface of the lens. So it is corrected by, how is it corrected? It is corrected by cylindrical lens, and here the cylindrical lens, actually it's corrected by a combination of spherical and cylindrical lens. So the answer is cylindrical lens. Distant vision. Distant vision is tested by Snellen's chart. So Snellen's chart here, I know cranial nerves is not done though, but then Snellen's chart is a chart where it's kept at 6 meters distance, and there are alphabets or letters which first letter will be big and broad, and the second letter, as the line tapers, it will be small letters. So you will have to read it by a 6 meter distance. So that is Snellen's chart. It's a chart. It's basically a chart, and the patient is made to sit at a 6 meter distance, and he is supposed to read it, and so whatever the line he reads, so it is, the distant vision is measured. So that means he can see at that distance. So if he can't read the bottom line, the last line, and as he keeps coming closer to the Snellen's chart, the uneducated, they can depict the picture of animals and all that. So it's called as a Jaggers chart, and it is kept at a 25 centimeter distance, and where he can read it. So Jaggers chart, it is for short distance, where he can read at that distance, whether he can read or no. So he is judged by that distance. Jaggers chart is used. Color vision. Color vision is again very important. Especially it is used in case of drivers, and in case of pilots, and in case of station masters at the station. Color vision is that important, and of course everybody, it is almost tested. Color vision is tested by Ishihara's chart. So there are different, of course we have told you all this in the theory part. Theory, I suppose it is covered, and we have discussed also, but in case of Ishihara's chart, you have different colors, and he is supposed to be identifying the different colors. And if he is not educated, so if he can't tell the colors, numbers and all that, you can give one color of a wool or a thread, and you can give different colors where you can match it with that color. Okay, so it is the color vision is seen by Ishihara's chart. It's tested by Ishihara's chart. Lesion of optic nerve. Now, visual pathway is a long essay question, and lesions of visual pathway is a long essay question. It can be a main question, it can be a short note. Lesions separately can be asked, different lesions can be asked. So lesions of the optic nerve. If the optic nerve is lesion, what does it cause? It causes blindness in the same eye. If the optic nerve itself is defective or lesion, in the same eye there is blindness, so it causes blindness in the same eye. Lesions of the optic tract. Now, optic nerve followed by optic tract. What does it cause? Now, it causes homonymous hemianopia. Now, what is homonymous hemianopia? We have covered it in the theory class. By now, you should know. Homonymous means it is on the, supposing the tract goes, and if it is on the optic tract lesion is there, homonymous means nasal fibers of the left side and temporal fibers on the right side. Or either you can take it, if it is on the left side, it is nasal fibers on the right side and temporal side of the left side. So it is homonymous on the same side. So nasal fibers of the left eye and temporal fibers on the right eye. So you see homonymous hemianopia, which we have explained it in the class. So lesion of the optic tract will cause homonymous hemianopia. Why is it lesion? Why is the lesion on the nasal side of the left eye and on the temporal side of the right eye? Because I suppose you know the fibers cross over. So that's why it is homonymous hemianopia. Lesion of the optic radiation. What does it cause? Optic tract, optic chiasma, then optic radiation causes homonymous hemianopia with macula sparing. So now you know homonymous hemianopia. I just now told if it is nasal side on the left side and temporal side of the right side if the lesion is there. Otherwise it is nasal side of the right eye and the temporal side of the left eye. So that is when it causes the tract is damaged because of the crossing of fibers. But here there is macula sparing. Optic radiation, there is macula sparing. Macula is an area. It is in case of lesions, extensive lesions, of course it is not spared, but in case of lesions, what happens? Radiation lesions, macula is usually represented in a big area, in a large area. Unless and until it is extensive, it is spared. So macula usually is spared with all these lesions because the representation in the occipital lobe is huge. So that's why it causes lesions of the optic radiation causes homonymous hemianopia with macula sparing. The macula is spared. Lesions of the optic chiasma in the midline. In the midline, mind you, it is in the midline, causes bitemporal. So midline, if it is in the midline, still the crossing. Okay, optic chiasma is where the crossing takes place. So now here it is lesion of the optic chiasma in the midline. It is homonymous hemianopia. That means it is on, it is bitemporal hemianopia. I'm sorry for that. Lesions of the optic chiasma in the midline causes bitemporal hemianopia. Means both on the lateral side. The lateral vision is affected because the lateral side, the fibers are not crossing over. It is just going. So it is bitemporal. Temporal means laterally. So it's bitemporal hemianopia. Usually the common example in case of pituitary tumors where it presses on the optic chiasma. So lesion of the optic chiasma in the midline. If there is a tumor sitting in the midline, it causes bitemporal hemianopia on the lateral side. So it is bitemporal. In Argyll Robertson's pupil, what reflex is lost and what reflex is preserved. So go and read up. Argyll Robertson's pupil is a short note. So usually here the light reflex is lost, but the accommodation reflex is retained. So in Argyll Robertson's pupil, the light reflex is lost. Please go and read up. Argyll Robertson's pupil is a short note. In a normal person, okay, next question. In a normal person, air conduction is better than bone conduction. Weber's test. While performing Weber's test in conduction deafness, okay. So what happens? The sound is lateralized and better heard in which ear? I have only taught you, okay. I think I've taught you this test of hearing. So in Weber's test, where you take a tuning fork and you hit it against your thenar eminence, hypothenar eminence, and you put it in the midline. Okay, so what is it? Which side is it? Lateralized. So it is better heard in the defective ear. That is Weber's test. The defective ear, you can hear the best sound. It is lateralized or it is better heard on the defective side. So in Weber's, while performing Weber's test in conduction deafness, the sound is lateralized or it is better heard in the defective ear. In nerve deafness, that was in conduction deafness. In nerve deafness, while performing Weber's test, the sound is lateralized or better heard in the normal ear. See, Weber's test, when I'm telling Weber's test conduction deafness, the sound is lateralized towards the defective ear. But when you're doing Weber's test in nerve deafness, that time the sound is better lateralized in the normal ear. So you should know what is conductive deafness, what is nerve deafness. The frequency. Next question, the frequency of tuning fork used. See, we have to use a particular frequency. This also we have told you. The frequency used of the tuning fork in Weber's test is 256 Hertz. Now, the frequency is measured in terms of Hertz and it is 256 is the answer. Taste sensation. The taste sensation from the anterior 2/3 of the tongue is carried by which nerve? Is carried by facial nerve. Anterior 2/3. So you can tell anterior 2/3. So at the tip of the tongue should be tasted for sweet. The center of the tongue is tasted for salt. The sides of the tongue, of course, you get the sour taste. And the behind part of the tongue, so always see whenever you swallow tablets, the behind part of the tongue is for bitter. So the anterior 2/3 is always supplied by facial nerve. Taste sensation of the posterior 1/3 of the tongue is supplied, is carried by, the taste sensation of posterior 1/3 of the tongue is carried by which nerve? Glossopharyngeal nerve. So anterior 2/3 is supplied by facial nerve, the posterior 1/3 is supplied by the glossopharyngeal nerve. The center for light reflex, right? Light reflex is a short note, okay? Is located in which nucleus? The answers are Edinger-Westphal nucleus, pretectal nucleus, ciliary ganglion and lateral geniculate body. So which is the nucleus where your light reflex is located in? Edinger-Westphal nucleus. Which of the following is true about rods? Which of the following is true about the rods? The answers, the multiple choices are rods depolarize when light impinges on retina, useful for color vision, more sensitive to light than cones, rods are thickly populated at fovea centralis. Now, which of the following is true? See, whenever you are reading an MCQ, please read it carefully. In a hurry, don't jump and mark it. Okay, so which of the following is true about rods? Obviously, it is more sensitive to light than cones. So the answer is the rods are more sensitive to light than cones. Which of the following nuclei is involved in both light reflex and accommodation? So we know the nuclei which is involved in light reflex is Edinger-Westphal nucleus. So what do you expect for the accommodation reflex? Of course, light reflex is a short node, accommodation reflex is a short node. You have to write the pathway also. So what is the answer? The answer is Edinger-Westphal nucleus itself. So you have both for the light reflex and for the accommodation reflex, you have the Edinger-Westphal nucleus only which is involved. One of the following ions is high in endolymph. So endolymph can be your short node. So which of the ions is rich? Which of the ions is richly present in endolymph? The answer is potassium. Which of the following special senses has no obligate relay in thalamus? So by now you should know thalamus is a relay station. Every pathway relays in the thalamus. But which is the one special sense which does not relay in thalamus? It is smell, isn't it? So the smell pathway. So each one is a short note here. Vision is a vision pathway, hearing pathway, taste pathway, smell pathway. So you should know everything. So now which of the following special senses has no obligate relay in thalamus? The answer is smell. Of course, refractive power is measured of lens is measured in diopters. Lateral geniculate body is concerned with, what is it? It's concerned with vision. So vision is lateral geniculate body. Myopia or short-sightedness is corrected by biconcave lens. Hypermetropia is corrected by biconvex and myopia is corrected by biconcave lens. Medial geniculate body receives what fibers? Lateral geniculate body is for vision. So medial geniculate body will be for auditory fibers. Again, it's the same. Medial geniculate body is concerned with hearing. Taste and smell receptors are, obviously it is chemoreceptors. Visual accommodation. Now you should know what are the processes involved in visual accommodation. First one, contraction of ciliary muscles, increased intraocular pressure, decrease in curvature of the lens, increased tension of the lens ligaments. So accommodation. So visual accommodation is involved what is the procedure that involves contraction of the ciliary muscles. Accommodation, that means the ciliary muscles have to loosen and contract. Okay, when you are seeing distant vision and suddenly you have to come to near vision, what happens? The ciliary muscles have to contract. So the answer is contraction of ciliary muscles. So visual accommodation involves contraction of ciliary muscles. The fovea centralis. Now you should know what is fovea centralis. It can be a 3-mark question also. So the fovea centralis of the eye contains only rods, is the region for highest visual acuity, has lowest light threshold, contains only cone. So what is the answer? Of course, it is the region for highest visual acuity. So the fovea centralis is the region for highest visual acuity. Okay, so this ends the MCQ on special senses. So all the best for your internals. Please do it very well and score good marks. Okay, don't get tensed, study. And I know now see, this is the period where you're just sitting at home and studying, isn't it? So you're not stressed going to college, coming back, and food and all. Of course, all of you all are having good food at home, and you all are in the best health, of course. And take care of yourself and study well and score well. Okay, thank you.